Hi, I'm Dr. John Sirota, and you're not. Today, I'm going to discuss with you why chiropractic care is the most important first step for anybody that is injured or has a chronic injury. I'm going to tell you that in the last 35 years of practice, people come to me all the time. Hey, I had 3 massage therapy sessions in the last 2 weeks, and I have these knots in my neck and shoulders. I've had acupuncture. I've had cupping. I've had dry needling. I've had physical therapy. And they still have these issues. And then they come to me and I adjust them. And then they all go away. Everything goes away. I want to tell you why that happens. Why does it happen that in this country, medical doctors send you to physical therapists first? I have nothing against physical therapy. I think it's great. It's very helpful. It deals with the problem head on, but it's also missing something, and that's what I want to point out today. As far as chiropractic is concerned, the education includes physical therapy. It's part of our education. We get the same education that they teach in a traditional medical college, with the exception of advanced pharmacology and, of course, surgery and things that are specific to medical doctors. Where they use drugs, we use nutrition. Where they use surgery, we use adjustments. Other than that, it's the same training, mostly. Now, when a person comes to me and they have problems that are occurring in their joints, in their spine, you need to understand that the joints in your spine, very similar to the joints in your hands, your knuckles. If I was to pop my knuckles now, and I know you all can hear that, that's a diarthrodial joint. It's a synovial joint. It releases nitrogen gas, makes a sound. And if I did that all day long, I would probably wear out the cartilage. But if I do it once in a while, it's restorative. It actually has a benefit. Years ago, they would say it causes arthritis. I imagine if you did it 30 times a day, you could. But if you do it once a day or twice a day, it's more restorative than anything else. Well, the same setup is in your spine. We don't call them knuckles, we call them vertebrae. They have the same sound when they get adjusted. But something very unique happens when an adjustment happens. There is a nerve that is freed, and that nerve invariably connects to some part of your body, including a muscle and an organ. So, for example, if I have tight joints in my spine, in my neck, and I also have neck pain and headaches, and I go to a physical therapist and we do range of motion exercises and it helps a little bit, and we do acupuncture at the acupuncturists and that helps a little bit, but still it's tight. It's not quite getting past a certain point. Now you go to the chiropractor and you get your neck adjusted, and what that entails is that the joints are now manipulated. The joints are gently encouraged to move in their normal fashion. Well, once the joint is normally functioning, everything around the joint, muscles and tendons and ligaments, will fall into line. Everything around the joint will start to improve better with physical therapy after a chiropractic adjustment. After a chiropractic adjustment, the acupuncture will work better. The massage therapist will be like, wow, I can't believe how much this deflated. This was like a rock, and now it really came down. What are you doing different? I got adjusted. Why is the adjustment enabling these improvements? It's neurological auto adaptation. So basically, when you have irritation to a joint in your spine, it irritates a nerve, and that nerve feeds the muscles involved that are causing you some discomforts. And unless that joint is restored to normal function, it is impossible for the muscles, the tendons, and the ligaments that are attached to that joint to function properly. We cannot expect full improvement unless the joints are adjusted. A chiropractor is uniquely trained to make those adjustments, not only for the localized area of improvement that, in this example, we're talking about the neck, but the overall balance of the nervous system. call it yin and yang. In science, we call it the sympathetic and the parasympathetic nervous system, otherwise known as the autonomic nervous system. The role of a chiropractor is to balance the autonomic nervous system for you. The net result is that everything works better. Your heart, your lungs, your liver, your spleen, all of your internal organs are in much better direct communication with your brain, and vice versa, after you get an adjustment. The side effect is that the pain goes away. That's the way it was back in 1895, when Harvey Lillard was the first patient who got adjusted by B.J. Palmer in Des Moines, Iowa. And over the next 125 years, since chiropractic's been around, we found that people do better with aches and pains, neck and back problems, and things of that nature, although it's not the intended purpose to rid that person of pain necessarily from its original philosophical standpoint. Naturally, in this country and being in practice for the last 35 years, of course, we want to help people get out of pain and feel better. But I explained to them that that's going to happen as a side effect, that the main effect is that once we have normal joint restoration and once the joints are adjusted and moving properly, not only are they going to feel better, but they're going to have better neurological transmission to every part of their body from their head to their toe. I'm going to call this the glass ceiling. So, if you know someone who has problems, challenges with headaches, sciatica, low back pain, mid back pain, pain between the shoulder blades, I'm sure you know 100 people right now that are having all those symptoms, and they're at the same time seeing a physical therapist or a massage therapist or an acupuncture, don't tell them to stop. Just tell them to get an adjustment in addition to that and watch their life improve literally overnight. My name is Dr. John Sirota. I have an office in White Plains at 600 North Broadway, right near Armonk, and I have an office in Stamford, Connecticut, very close to the Merritt Parkway. It's a home office, it's professional, and if you have anyone who would like to see me, please contact me. I will leave a link on the bottom of the video. It's been great talking with you today, Dr. John Sirota. Have a good New Year and a good holiday season.
It's a brand new day.